Hi everyone, we're here today to talk about drawing up our weight loss medication. And what I wanted to do was to show you two forms of doing that. This is Mounjaro. Mounjaro is the product by Eli Lilly. Tirzepatide is its generic name. It comes in a pin format in the box. There's usually 4 of these in the box. And this is already pre-filled. It's 5 milligrams in 0.5. You inject it by pressing the little button onto your skin. And so this is the pre-formed format of tirzepatide, and it comes in that little box. If you get it from a pharmacy that's compounding the medication, it will come in a vial, and it'll tell you how much you're supposed to inject either on your patient portal or on the instructions when they come in, but we don't have the box here today. So what we're going to do is we're going to draw up 20 units, of tirzepatide so that you know exactly what you're doing. Now, this particular medication is just the tirzepatide. Sometimes it comes from a pharmacy with vitamin B in it, and it will look pink or dark red. And so we're going to, just for purposes here today, draw it up from this particular pharmacy so that you can see what that would look like in the colored format with vitamin B in it. So what you're going to do first is wash your hands, which I've already done. I've laid out all my supplies, and I'm going to get my syringe and verify it. Okay, so we're looking at our syringe here. We see this is the units, and we're going to look for 20 units right here. 20 units. This is where we're going to draw up the medicine to. Okay, so what I'm going to do is get my alcohol ready in the little baggie. And we're going to take off the sealed top to the medication, and we're going to just clean that off really well. Put this back here. First, we take off the bottom part of the syringe. We don't need that. And then we can take off the top of the syringe, and we see the little needle. And I'm just going to pull the stopper down to 20 units to show you again, this is exactly where we're going to draw up. So right now we have air in the syringe in the same amount of what we're going to take out. So I'm going to pick up the vial, and then I'm going to vertically insert the needle, okay, straight down very carefully so I don't bend the needle. And then I'm going to invert the bottle and push in the air, pushing in the air the amount of medicine that I'm taking out. Okay, so now little by little we're going to just pull it back, and you'll see a little air bubble there. Not to worry. What I generally do is pull out a little bit more than what I need, and then I flick the syringe a little bit to try and dislodge those air bubbles, and I push back in that extra amount to make sure that that little air bubble went back in. And there, if you have a little tiny one, it's not that big of a deal, but you want to get rid of most of it. Okay, so right now you can see we're at 20 units. So I'm going to take out my syringe, put the vial back down, and now I'm